Dengue fever in general is very similar to other fevers. However, there are an additional set of symptoms that patient with dengue fever present with. One of them is retroorbital pain, that is pain behind your eyelids. This is a very classic symptom of dengue. Along with that, the patient suffers from joint pain, muscle pain, and general fatigue is there with almost every fever. In other viral fevers, the patient usually gets well by the seventh day or the eighth day. However, dengue patients usually take about 2 weeks to get totally fine. And dengue fever, if it turns into a severe dengue fever, is fatal. Now, what are the causes? See, dengue is spread by the bite of an Aedes aegypti mosquito. In malaria, it is caused by a female mosquito. However, the dengue mosquito is usually a day biting mosquito. There is no night or an evening prevalence. Usually, during the day from dusk to dawn, the mosquito bites. And it is spread by mosquito, or it can also be spread by infected blood. People who do drugs use infected needles, it might spread by that way also. It might spread by infected blood transfusion also. The major mode of spread is always a mosquito bite. There are a lot of reasons right now that in India the dengue cases are rising very fastly. One reason that I would like to attribute is to the neglected surveillance programs that our government is running right now. Usually, there must be round the year guidance and seminars and lectures and fogging done for mosquitoes. However, in our country, due to the lack of manpower, apparently, uh, people are appointed only during the rainy season. That too, the work is always delayed. The prevention and the preventive measures are always delayed. Insecticide treated bed nets or other insect repellents should be distributed for free. Insecticide residual sprays are available in the market. The majority of the population is poor, so definitely people are not well aware of these facts. And the government also, it does programs, but most of the programs are delayed. They do not occur on time. And nowadays, this fast rate of urbanization is also a reason. Most of the roads you see, they are broken. They have potholes, pit holes. Water keeps on collecting. The stagnant water gives a very nice area for the dengue mosquito to breed. So perhaps these are the many reasons that dengue is spreading in the country at a faster rate, especially in the rural and highly populated areas. The symptoms of dengue are, first is fever. That is the most common symptom that the patient will present with. Fever associated with pain behind the eyes, known as retroorbital pain. Weakness, general tiredness that the patient will complain of. Muscle pain, there will be joint pain in the patient. There will be severe headache. And the patient might also complain of vomiting and abdominal pain. Children usually have very severe dengue fever and they have to be monitored closely. They might have immense bouts of vomiting and abdominal pain and headache and general flu-like symptom associated with rashes on the body. Rashes usually occur when your platelet count reduces below a certain level. You might have nosebleeds, you might have bleeding in your gums, or you might have many rashes on your body. Patient must keep in mind when he has dengue fever. So if you suddenly start experiencing tremendous pain in your stomach, or if you feel the size of your abdomen is increasing, if you find a lot of rashes on your body, red colored spots, if you notice on your body, keep in check. Whenever you have dengue, keep in natural light, keep seeing your arms and legs or your trunk for any rashes. See if your mouth, your gums bleed. See if you have blood in your stools, or if you develop intractable headache. So your dengue might turn into a fatal infection. And keep in touch with your doctor to for a regular monitoring of your platelet levels, because once the platelet drop to a certain level, you might have very severe complications. Your normal dengue fever might turn into a hemorrhagic one. There is general plasma leakage in the body when a patient has severe dengue fever. So this patient might also develop fluid collection around the lungs, which might lead to breathing difficulty. So keep in touch with your doctor so as to avoid these complications. Nowadays, many rapid antigen tests are available in the market, which are cheap also, to detect the NS1 antigen of the dengue. Other tests like RT-PCR are also available in the market, but since these tests are a bit costlier, so in India we usually test dengue by the antigen detection test. First of all, what are the do's? Whenever you see that the rainy season is around, or you start noticing cases of dengue or malaria in your area, start wearing long sleeved cloths. Wear cloths at least covering your wrist. Don't wear shorts. Wear any clothing which covers your entire body. Always go out with a mosquito repellent, or nowadays many creams and sprays are also available. Use insecticide treated bed nets. Use window covers and door covers. Avoid opening your doors and windows for long durations. Avoid collection of water. See, dengue spreads in when the mosquito breathes in stagnant water. So avoid any area where you might have stagnant water collection. Keep changing the water. If you have water cooler, keep changing and shuffling the water. Rest is avoid going to places or people where you have heard that dengue cases have occurred, because the mosquitoes there might be Aedes, of course. Dengue usually takes about 7 to 10 days in general to cure. Dengue does not have a particular cure. There is no drug which can completely cure dengue. In dengue, the treatment is usually symptomatic. So it varies from people to people depending on your immunity and depending on your platelet levels. In general, what I've seen is it is about 10 to 15 days a patient will take and the patient will get cured. And after that, it is just adequate nutrition and diet and keeping up a regular follow up with your doctor. Dengue is a viral illness, and 99% of the viral illnesses have a post viral syndrome, which usually comprises of fatigue. A patient tends to feel tired all the time. He might have muscle pain, he might feel lethargic, might also develop joint pain or headache. So the basic thing to get out of any viral illness is adequate nutrition, good diet, keeping adequate hydration. The hydration is the most important part of post dengue or in dengue disease. Keep checking up with your doctor, and definitely include papaya leaf juice in your diet so that the platelet level is maintained in your body, and add fresh fruits in your diet. This way, you will avoid post dengue complications. For the prevention of dengue, you have to wear long sleeved t-shirts, clothes covering your entire body. Avoid going out in short clothes. Second, avoid collection of water in and around your house. Keep changing the water in your water cooler. Keep your doors and windows closed most of the times, and avoid going to places where you hear dengue cases or any malaria cases are happening. Try staying indoor mostly during this time if you live in a very populated area, and rest is adequate nutrition and diet, and in case you develop symptoms, do visit your doctor. First of all, I'll tell you what all should not be given to a dengue patient. First thing is avoid fatty food. Avoid a food that is fried, has a lot of fat content, because then your stomach will find it harder to digest. Next is avoid vegetables such as cabbage, turnip, and capsicum. Since these vegetables are known to be inflammatory, these might cause a lot of bloating and abdominal tenderness, and in general increase your fatigue. So avoid these vegetables. Next is avoid caffeinated drinks like coffee and tea, because these elevate your blood pressure, and we want the patient to be stable right now. Avoid cold drinks or soda drinks. Avoid any alcohol or any substance abuse that you're addicted to. At least reduce the number if you're unable to avoid it totally. Next, what all you have to take? First is that maintain adequate hydration. Always drink 5 to 6 glasses of water. Keep in mind. See, 5 to 6 I am telling because right now you will be taking additional things to maintain your hydration. Include coconut water in your diet. Coconut water is a very good source to maintain prolonged hydration in a patient. Plus, it is a rich source of vitamin A and C, so it helps you in healing also. Include fresh fruits in your diet like pomegranate. It is a very good fruit to improve your immunity and maintain your blood levels. Include kiwi. Kiwi is again a very good source of vitamin A and E, plus kiwi helps in maintaining good blood pressure. Also include soups in your diet, because right now you all the food that you are to be taking should have a lot of fluid and it must be easier to digest, so vegetable soups are a good source again. Also include light food like khichdi, dal soaked in milk. Dairy products in dengue help a lot, so you might eat roti soaked in milk. You might add yogurt to your diet. So include these. These will definitely help you in recovering and treating your dengue faster.